Well, good morning. I'm Dave Weed. I work for Partners for a Healthier Community, and we've begun to take a look at some of the policies around obesity prevention because over the past 4 or 5 years, we've been looking at some information about what leads to weight gain and what leads to weight loss. And we thought that the policies we were following really are not adequate to the science that's available now. So this is a presentation about what we could do to change our approach to obesity prevention. Obviously, obesity is a major concern. I don't have to tell anybody in this room, but BMIs have been rising for approximately 40 years, steadily. They continue to rise, and the most recent report showed that obesity rates have not slowed down. There's a little plateauing in the last 2 years, but they're still rising, is the point. And despite everything we've been doing, the population seems to be gaining weight regardless. Well, we've had an approach to weight loss. Some of this should look familiar. Calories in, calories out. Sound right? You hear that all the time. Meaning either reduce the amount of food you're eating or increase the amount of activity and exercise. We've heard a lot about balance. You may have heard recently that Coca-Cola has talked a lot about it's a matter of balance, right? Balancing the calories in with the exercise or energy out. And we've been telling people that they should limit their calories and increase their activity in order to control weight, but guess what? Even though we've recommended that people cut their fats, because we all know that fats are calorically twice as dense as carbohydrates, right? So that seemed like a good strategy. We've encouraged people to be more physically active, and we've been trying to make the healthy choice the easy choice. Population weight, though, continues to go up, and along with that, diabetes rates. Has anybody read the most recent report about diabetes? Just published in JAMA last week. You ready for this? Diabetes rates 12 to 14%. Okay, this is diagnosed with A1Cs on a population of 5,000 people. So this isn't a guess, this is actual measurements. Pre-diabetes, okay, measured at A1Cs above 5.7, okay, 37 to 38% of the population, okay? Yeah, I see a lot of expressions here. This isn't good, folks. We have 52% of the population currently who's either diabetic or pre-diabetic measured, okay? So despite all of our efforts, things don't seem to be going in the right direction. There have been some evidence among preschool children about leveling off of weight, okay? But I'll talk to you more about that a little later on. So what are we doing wrong? The standard definition of insanity, doing the same thing over and over again, expecting different results. And that's pretty much been the history of the last 20 years in public health, trying to make things better with the one assumption about diet and exercise. So over the past 5 years, as I've looked at some of the research and some of the alternative points of view, it's become clearer and clearer that some of our assumptions are not right, that any calorie isn't equal to any other calorie. Calories from some foods are different than calories from other foods. And that perhaps activity, physical activity, though it's good for all kinds of things, is not necessarily going to lead to weight reduction, okay? A man by the name of Ansel Keys, back in the 70s, started a lot of our current theory about obesity, about weight gain, weight loss, and actually he wasn't even a nutritionist or a physician, but he worked out of the University of Minnesota and came up with a 7 countries theory in which he tried to demonstrate that after visiting Greece and enjoying the good food there, that people in Greece were, in particularly one island, were much less likely to develop heart disease. So we went back and started gathering some statistics and came up with a graph that seemed to show that the more fat, dietary fat that you consumed, the more likely you were to develop heart disease. And that was a great theory. No one had ever before proposed the idea that fat was bad for you or that it had any connection to heart disease. What he further suggested is that in order to reduce heart disease and a variety of other ailments, the dietary component of fat in the entire American diet should be reduced. That led to the food pyramid, and that's the old food pyramid before my plate, with 6 to 11 servings of grains, and then way up at the top, a little bit of fat, okay? And we've all grown up with this in one form or another, whether you are aware of it or not, because food manufacturers began following and reducing fats in products, and now market low-fat products. About a third of what you find at the grocery store attempts to get you to buy it because it's lower in fat. But carbohydrates were given a free ride, and as we all know, when you take fat out of something, you've got to replace it with something if you're going to have the same calories. So what do you replace it with? Sugar, okay? You take fat out of milk, for instance. How many people here love the taste of skim milk? Okay, I haven't found anybody who likes it. Yet, right over there in the cafeteria, that's pretty much what we give kids. And in order to make it palatable, we allow them to put 6 teaspoons of sugar in, along with some chocolate flavoring, etc. So now kids are getting a walloping load of sugar, but no fat. And fat, as we know, is what you have to have for fat-soluble vitamins, right? 4 of them. Yet, and one of them being vitamin D, we take fat out of milk and then expect kids to absorb the fat in the milk, absorb the vitamins in the milk without the fat, and it doesn't work. So, if we look at a chart of what happened, carbohydrate consumption went up, fat consumption began going down, protein stayed about the same, but as soon as we started our food policy, up went weight. And that's been the story ever since then, that by taking fat out of our diet and adding carbohydrates, people have simply gained more weight over time. In other words, our policy caused the obesity epidemic. Now, you can say that there are many other factors, and there were, but this one factor alone probably accounts to at least half of the problem with weight gain in America. Food manufacturers love the idea of taking fat out of food. Why? Costs more money to manufacture something with fat in it. Take the fat out, replace it with sugar, which is cheap, or other refined grains. We have a variety of products now available to us that don't cost the manufacturer any, but despite the fact that we've been eating these low-fat products, our weight continues to go up. Well, we must not be exercising enough, right? Because we all know that the way you lose weight is to sweat it off, right? We've seen the Biggest Loser and other programs, and the whole idea, we do a fitness challenge here every year. People come in, committed to losing weight, and they work and work and work and sweat. And what happens? They don't lose weight. If anything, one of the things that happens when you exercise a lot more is you get what?
Muscle.
Well, you get muscles.
Muscle weighs more than fat.
And you may lose inches, but not pounds. But you also get hungrier. People forget that when your body works and creates a caloric deficit, then your body is going to seek to get those calories back again. And though you can stay on a calorie-restricted diet and manage by going hungry a lot. Anybody ever gone hungry on a diet? Okay, it's the universal experience on low-fat diets is to simply become hungrier. Over time, what happens? People give up. Okay, and that's the story. Weight loss is only successful in about 2% of people over a long period of time. Most people who lose weight on a low-fat diet end up gaining the weight back, and often more. So exercise may not be the right thing. Could it be something in our environment, toxins, hormones, etc.? Of course, we're more sedentary, we think, though there's a variety of, Steve, I'm sure you know all the stats on that. There's some studies that say we're more sedentary. There's other studies that will tell you that we've actually increased our gym membership. People are trying to be more active in some ways, but regardless of anything we're trying to do, that doesn't seem to help either. So the alternative is maybe our advice was wrong in the first place. Maybe we are eating the wrong foods, types of foods. Maybe the dietary guidelines were not correct. Anybody been paying attention to what's going on in Congress with the hearing just 2 weeks ago? The dietary guidelines are up for change every 5 years, and they're going to be reissued at the end of this year. But the congressional hearing of the Agriculture Committee, did you listen to that, Steve?
I haven't listened, but I know
it's a 2.5 hour. If you want to hear our government in action, it's a pretty interesting kind of discussion that Bill Sack, the Agriculture Department Chairman, and the Health and Human Services Director, Burwell, had to answer questions. And one of the questions was, why do you put out recommendations that people no longer believe? They're following these recommendations and they're gaining weight. It's not helping. So what could you do differently this time to help prevent this rising rate of not only obesity but diabetes? Can you make some changes? And have you looked at the research? Well, probably the only group that's now advocating for balance in the sense of calories in, calories out is Coca-Cola, who brought together their best scientific experts, who I'm sure were completely neutral on the subject, and have said that, if you eat too much, you just need to exercise a whole lot more. But we, of course, know that the amount of exercise that you have to do to burn off one little cookie is, half an hour workout. We can eat far more than the exercise will remove the calories that we take in. One of the most influential authors that's helped me understand this is Gary Taubes. He's out in Berkeley. He wrote initially a book called Good Calories, Bad Calories, kind of a poor name, but he basically researched how we got to the place that we recommended low-fat diets and began to look at what actually happens when people reduce fat and increase carbohydrates. Carbohydrates have a unique property in our bodies. They actually, all foods stimulate insulin, but carbohydrates stimulate insulin a great deal more. Insulin comes from our pancreas, and its one job is to simply get glucose, sugar, out of our bloodstream, because if it stays there or gets at too high a level, it's toxic and can begin causing damage to our arteries, particularly in our eyes, our kidneys, etc. So our body is made to remove sugar from our bloodstream. Yet when we eat any carbohydrate, it gets converted to sugar. So having a recommendation that people should eat more sugar in the form of carbohydrates and less fat only resulted in stimulating more insulin, and the way that insulin removes glucose from the blood is to park it in our cells in the form of fat. So while we were all saying, oh, if I don't eat fat, I won't get fat, we were eating the very kinds of foods that make us fat. So the advice was wrong, according to Tobbs. Embracing sugar and other forms of refined carbohydrates made no sense. Last May, Nina Teicholz published The Big Fat Surprise. Has anybody here read it, or anybody know it? Yeah. It's on the New York Times bestseller list. It's actually a worldwide bestseller right now. If you want to understand how we got into the dietary and obesity mess that we're in, I recommend you read this. There's a short version, for a quick read book on Amazon for about $7, and you'll get everything she talks about. But the book itself is excellent and goes in great detail to help us understand why this current dietary recommendation evolved to make us believe that the right way to go was to remove fat from our diet. So the big concern that Ansel Keys brought up was that fats would cause cholesterol, blood lipids, to rise and lead to a heart attack, right? In fact, when he was writing in the 1950s, Eisenhower had just had a heart attack, and everybody was concerned that they were going to get a heart attack. So hearing that just cut fat out of your diet seemed like a good way to go. People ignored the fact that Eisenhower was a smoker, as were half of the 40% of the adult population back then were smoking cigarettes, but nobody back then saw that as a link to heart disease. So here we were taking fat out of our diet and continuing to smoke, and people were continuing to have heart attacks. Didn't make a whole lot of sense. What is current about the research is that there is no relationship between dietary fats and blood fats or lipids, HDL, LDL. The idea that you eat fat and it, you all heard, clogs your arteries, couldn't be farther from the truth. That's not how our bodies work. The fat that's deposited in our fat cells in our body comes from carbohydrates that are not used, not from fats. In fact, some fats, if we don't use them, aren't even digested. So this whole notion that fat was going to lead to heart disease has been debunked over the past 10 years. Cardiologists now do not believe that dietary fat is the cause of heart disease. What they're most concerned about now are sugars and refined carbohydrates. Granted, back when Keys was doing his research, we only knew about total cholesterol. That's all that we could measure. Then we learned how to measure LDL and HDL. Now we're measuring different subcomponents of LDL. And the two subcomponents are critical in terms of understanding heart disease risk. The very dense lipoproteins are the ones to be concerned about. And those rise when you have sugars and refined carbohydrates. It has nothing to do with fat in your diet. You're going to talk a little bit more about that?
Just the fact that there's dietary fat, there's blood lipids, which we call fat in our arteries, and then there's adipose tissue, which is our fat that we store. We have different names for them, but everybody just calls them all fat. And then you also have dietary cholesterol and body cholesterol, which have nothing to do with each other either.
That's part of the problem, is that people are confused. So basically, we remove fats from food, replace them with sugars and other carbs, They're not the root of arteriosclerosis. As far as heart disease goes, we have actually been making things worse. That's not to mean that more people are dying of heart disease. More people are living with heart disease today because we do a better job of treating it. But the rate of heart disease has not gone down substantially. So insulin stores unburned carbohydrates as fat, all of it. Okay, there's no, either you burn it or you store it. You don't excrete carbohydrates. That's not how it works. The sugars have to go somewhere in your body.
Not unless you're on Farxiga.
Right.
The diabetes medication.
Oh, okay.
If we eat too many carbs, cells become resistant to insulin, leading to elevated blood sugar and type 2 diabetes. So in order to reduce weight gain and the development of diabetes, we should cut back on carbohydrates. What we took out of food, we should put back in, or better yet, don't take it out in the first place. That's called whole food. Okay? If the food comes with fat, leave it there. All but the A and B vitamins are fat soluble. We need fats in our diet to benefit from the vitamins in fruits and vegetables. Okay? And Amanda's going to cover some of that in a few minutes, right? B and C vitamins, thank you. Yeah, it's on your paper, should be,
It
right?
is on the paper, correct?
Right.
Yeah.
I got an earlier version of this here. So, yes, fats are twice as calorically dense, but carbs, on the other hand, stimulate appetite. And we know that when you drink a lot of sodas and things of that sort, you tend to get hungrier for more sodas. The more carbs you eat, the more carbs you want. Go back there. So, given that information, what approach should we be taking? Because high-fat foods increase, we thought they increase lipids, they do not. It's the small, dense lipoproteins that need to be changed in our diets. Cutting carbs does better than fats. There have been 18 studies to date comparing low-carb diets and low-fat diets. Low-carb diets for weight loss win every time. And whether they're short-term or long-term. Anybody familiar with the Hall study that just came out on NIH this summer? And it said, proof conclusive, low-fat diets are better than low-carb diets. Anybody recall seeing that? Well, if you look at that study, that was a study of 19 people that occurred over 6 days, okay? And what they did was measure very small weight changes. This was done in a laboratory, you know, where they submerge people in a tank of water, and, you know, they tell what volume they're displacing and things of that sort. And over that 6-day period of time, yes, the low-fat diet did result in more loss of fat, not more loss of weight, than the low-carb diet. And we're talking fractions of an ounce here, okay? But the study was only done for 6 days. If anybody knows anything about low-carb diets, you know that it takes 6 days just to begin the induction to get your body to shift over to fat-burning mode, so that it wasn't enough time. And the low-carb diet was 140 milligrams of carbohydrates, 140 grams of carbohydrates, which is a large amount. I eat 20 a day. 140 is close to what most people eat all the time.
Well, I would call that moderate.
Moderate, yeah.
A lot of people eat upwards of 300 to 500 grams a day.
Right.
So,
But
they feel
140,
like lower, but
right.
not really low.
140 is just a little lower than normal, but not really a low-carb diet. So it really didn't demonstrate anything. And CDC still recommends a low-fat approach to diet. Okay, anybody doing the CDC diabetes prevention program, Chapter 2, be a fat detective. Okay, although I'm hearing that there may be some loosening up on some of that, or not yet? Not yet, huh? Okay. I always say that telling a diabetic to continue to eat carbohydrates at high quantities is like telling an alcoholic to have a couple beers every day. Okay? Doesn't make sense. So, can you cure diabetes with low carb diets? Yes, and it's being done a great deal now. In fact, there's a clinic out in that Kaiser Permanente has started as a low carb diet clinic for people on diabetes. Amanda's going to talk about some of the work that she's been doing here on that. Is it hard to follow low carb diets? I don't think so. I've been doing it for 6 years. I don't have a particular problem except when I go to events where all they have is low fat this and low fat that and no fat. I was so happy when in fact, the reason I got onto Andrea is that I finally went to a meeting where I could eat the food that they were serving. And some of that you're going to have at lunch today. It'll be a low carb diet and some of the items that you'll see here. So to be able to eat more fats and fewer carbs, as long as you can find the food, does fine.
I think it is hard. But you can travel when you're.
It's hard to find the food, right?
Yeah,
Yeah.
depending on where you are and who you're
Right.
with, it can be really hard.
Yeah, so you have to plan for it and often have to bring your own food in certain circumstances. On exercise, growing body of evidence shows that exercise alone has almost no long-term effect on weight loss. People, in the short run, yes, you can lose some weight by exercising. It's good for maintenance of weight, and exercise is good for a lot of things. But to simply say to people, you just need to exercise more, is what Coca-Cola is telling us. If you want to take that tack, go ahead. Bring back full-fat, unflavored milk in schools, and for the 38% of us who are carb sensitive, that is, we're pre-diabetic, go with lower carb veggies and fruits that don't stimulate insulin. And stop recommending low-fat diets as a weight loss strategy. The science doesn't support it. We need to understand that weight gain is driven primarily by hormones. Okay? It's not calories in, calories out. It's how your body responds to the different types of food that you eat that you have to pay attention to. And let's talk about carb sensitivity. About half the population appears to handle carbohydrates okay. Not a big problem. And that's fine. We're not saying everybody should avoid carbohydrates, but those who are carb sensitive need to know it and need to know what the alternative is. And stop doing let's move kinds of programs. I heard that Michelle backed away from some of her food recommendations, dietary recommendations, because the food manufacturers didn't like some of the things she was saying, and now it's all about exercise. Well, exercise is good. I have nothing against exercise. But if you're going to address the problems of an overweight diabetic nation, you can't just talk about exercise. You've got to talk about food and diet. We have seen reductions in BMIs in the WIC program. Nobody can seem to figure out why some of the kids in a few of the states actually dropped their weights, but it coincided nicely with dropping fruit juice from the WIC diet. You think maybe that had something to do with it. Sweden is the only country that currently has leveled off in terms of their obesity rates, and 23% of the population in Sweden now follows a low carbohydrate diet. Coincidence? And you're hearing a lot, certainly on the internet, there are a lot of options for people in terms of paleo and low carb options, sugar busters, zone diet, etc. So people are finding out for themselves alternatives to diet. In Fall River, if you look through your packets, you'll find we've changed our guideline for healthy meetings. If you read the food recommendations on that, you'll see that we're now talking about adding fats and not removing them. We also put together a 20-minute video, and I recommend when you're home sometime, you get a chance to look at this. It's on the internet, there's a URL, and the entire script is on this brochure. But that's a way of educating people about what we think is a better way to go in terms of changing dietary patterns. Marcia and Angie and others working with us now have a major emphasis, actually going back about 3 years, on sugar and getting kids and parents. And we're beginning to see some change, yes?
Without a doubt, great. We have when we go to health associates and so forth, and also the family fun nights that I run at most of the area schools in Greater Fall River, our partners display is all about giving up soda, cutting down on sugar-sweetened beverages. And 3 or so years ago, when we first started doing this, the norm for a family walking by the table was, well, yeah, we drink soda, we probably shouldn't. And now the norm is the exact opposite, that I would say a good 70, 75, 80% of the people that walk by say, oh, no, we don't have soda in the house anymore. We don't allow our children to drink soda. Last year, I believe it was, we added juice to our table with, instead of an X that I've got on the cola bottle, which doesn't have an actual product name on it, it just, it's cola. But the juice has a question mark on it, so that we do say that although there are some vitamins in the fruit juice, it still contains just about the same amount of sugar. And almost every parent that I talk with that talks about juice now, before I even get a chance to deliver the punchline, they will already say, oh, if we do have juice, we cut it with water. So it's 50% juice and 50% water. So something's working. I mean, it's definitely changing, definitely.
Thank you. And one thing that is changing is how we're treating people with diabetes. And I'm going to turn this over to Amanda, who works in the Diabetes Management Program for Southcoast Health, and she will explain to you the approach that they're using with people with diabetes and following basically what this dietary guideline change is all about.
Okay, so my name is Andrea Raposo, dietitian, diabetes educator, and so this is all about me trying a new approach with my patients. Just to give you a little background, sorry. My formal education, I started in 1998 with URI, and I did my bachelor's in food science and nutrition. Learned all about eating fruits, vegetables, whole grains, low-fat dairy, and lean meats. And then I did my internship through Southcoast, and again, worked on getting the practical ways of working with my patients, encouraging the same things. Then I started working for the cardiac prevention program, and we went out in the community and did cholesterol screening and blood sugars and got the results right there and got to talk with our patients. And I always thought that there was a weird paradox that if you had saturated fat, it brought your LDL up. But if you had sugar, it brought your triglycerides up. How does your body know? How did it, it never sat well with me as I was talking with people about those things, that, triglycerides, and I definitely saw a very quick impact on triglycerides with my patients. I had one guy who came in, his triglycerides were over 650, and so that's as far as my machine would go. So I don't know if it was 651 or if it was 1200, but I told him to come back the next week and we discussed what he was having. Orange juice every day, coffee milk every day, and chocolate every day. So we cut those 3 things out, just those 3 things, and his triglycerides were 214 the next week. So definitely a direct impact there. But somehow saturated fat fit in there. I just never really got it. But, and I got my RD, and passed the RD exam in 2004. And then I went back for my master's at Northeastern for applied nutrition. More of the same information. I went, the concentration was obesity and eating disorders. There was some talk about, is it really sugar or is it high fructose? And so they had some interesting studies that we went through, but the thing that killed me in that master's was reading all of those studies and everything needs more research. Nothing was conclusive. And so it was very frustrating looking at all that, like, what are we spending our money on? Why don't we have answers? So then started my low carb education. Thank you, Dave. He got me to read Why We Get Fat by Gary Taubes, and although it was the easier version to read, besides the good calories, bad calories, I still had to put it down every once in a while, like, oh, what? Like, this makes so much sense. So that book really changed my practice. And then I tried it myself, and I cut back on carbohydrates, and then I was daydreaming about pasta and potatoes and realized I'm a carbaholic. I have a problem. So I've learned a lot since 2011 about my own experiences, how I feel better when I eat this way. I realized that my cholesterol got a lot better no matter how much fat I ate. My blood pressure got better, my breathing got better, I wasn't bloated, my achy knees felt better. Sleep, energy, it was like, wow, does everybody have this much energy? I was in a carb coma before. So that was my own personal learning. But then I wanted to know more about the research behind why this works. And I wanted to teach my colleagues. So Diet Doctor was an awesome reference. He's from Sweden. Authority Nutrition, they're from Iceland. Apparently you have to go outside the US to get unbiased information. A Bitter Truth is a different type of, it's a medical lecture, 90 minutes. If anybody has heard about Dr. Lustig, he focuses on non-alcoholic fatty liver disease. Very interesting, but it brings another aspect to refined carbs and health. And then Live and La Vida Low Carb is run by Jimmy Moore. He's not an expert, but he talks to a bunch of experts. And so I've learned a lot from his podcasts and blogs. And then the next thing was starting to work with my patients. And holy cow, did I learn a lot there too, because they had different problems than I did. So it was different. So this is my new approach. Don't eat processed crap. Let's go back to encouraging real food. So I start out with my patients with the bad news, and they don't like me for a little while. But by the end of the hour, they do like me. And this little graph, I couldn't really find it. I decided to just draw it. Carbs are going to be what increases your blood sugar the most. Proteins only affect your blood sugar half as much, and they last for a longer period of time. And then fats hardly touch your blood sugar at all, only about 10%, and they last for hours. So when you keep that in mind and how things work with your blood sugars, even if somebody has an obesity problem or some other problem with insulin resistance, it all comes back to especially those refined carbs. I don't have a problem with non-starchy vegetables or low glycemic fruit, but especially those really carb-dense foods. Some are really not beneficial. So that's why I focus on carbs. I don't focus on calories. I don't focus on fat, sodium, nothing, just carbs. Then I connect the dots between the insulin resistance symptoms they may have, whether it's diabetes or weight or their cholesterol, which Dave already has done a lot of that talking about that subject. Hypertension, carbs make you retain water, so does sodium. But if you're reducing carbohydrates for other reasons, you may see that your blood pressure also gets better at the same time, so you don't have to worry about salt as much. COPD, carbs make you breathe harder. There's actually low-carb diets prescribed already for COPD, but nobody really wants to talk about them because they include fat. So, depression and anxiety. A high intake of carbs, especially a lot of soda, will definitely aggravate depression and anxiety. And NALFD is non-alcoholic fatty liver disease. The fructose sugar breaks down into glucose and fructose, Glucose is responsible for all the insulin resistance. Fructose is responsible for non-alcoholic fatty liver disease. If you want more information, go back to that YouTube video.
And so I approach this with my patients in two different ways.
The first way is we have a food list with the diabetes management program that breaks down foods into the 15 grams of carbs per serving size. So they can use the serving size chart to keep their carbs around 30 to 45 grams of carbs per meal. But I have encouraged my coworkers not to recommend any more than 45 grams of carbs per meal. It just doesn't make sense. These people, Dave says carb sensitive, I say carb intolerant. So if you can't tolerate that large amount of carbs, we really shouldn't be recommending that much. But for some people, just cutting back from the 500 grams of carbs a day, or like I had this one girl, she works at McDonald's, and she'll refill her small soda like 12 times. That's 700 grams of carbs just from her drink. It's ridiculous. So cutting back to a moderate amount, 30 to 45 grams of carbs, really works for a lot of people if they've been really over-consuming for a long period of time. So for some people, the moderate approach works and the carb counting works. For other people, I give the handout that's actually in your packet from Diet Doctor about low carb. Some people have had an awesome time with Atkins in the past. So why can't they do that again? If they enjoy eating that way and fat's not an issue, then we should allow them to go ahead and go back to eating that way. So at the top of the handout, it's all the foods that you can have. Any kind of meat, any kind of fish and shellfish, eggs, as many as you want. This diet doctor, he says a max of 36 eggs a day. Because it has nothing to do with body cholesterol. And then vegetables that grow above the ground. Your dairy should be whole fat dairy, because if you take the fat out, a lot of that milk sugar is going to digest too quickly. And then nuts and berries in moderation. Some people can tolerate them, some can't. So then we have the foods that we need to restrict, the sugar and the starches. Margarine, I encourage everyone to go back to real butter. Grass-fed, if you can afford it, that would be great. It's so much better. Beer is liquid bread, and fruit is nature's candy. So that category, the whole avoid if you can, is really what people can tolerate. If you're doing severe low carb, you would cut those things completely out, but some people can tolerate a little bit more than others. So then the rest of the handout just kind of explains how they can go through and do low carb. They have examples of breakfast, lunch, and dinner, and snacks, and when you go out to eat. Then the third page is all of the shopping list. Sorry if I'm out of breath. Pregnancy. I usually talk faster and I can't. So then things to clean out of your pantry. If you look at the shopping list, it's all real food. If you look at the stuff to clean out of your pantry, with the exception of potatoes, everything has been processed. So really, whole food, low carb is really just going back to whole foods. On the back page are just some examples. There's a recipe for oopsie bread. Took me a while to try oopsie bread, but let me tell you, that is so good. Very easy to make and really good. And then there's mashed cauliflower and low-carb chips made out of baked Parmesan cheese. So it gives the person a little bit of some examples of how to get started. But one thing I definitely emphasize is that if you are cutting back on carbohydrates, whether it's moderately or severely, you need to increase your fat. And that is something that a lot of people have problems with. But more about that in a couple of slides. So, we talked about their carb allowance, determine which of the two paths they want to go, or if they want to do a combo. If they are carb counting and doing 30 to 45 grams per meal and 15 to 30 grams per snack, they are not rollover minutes. You can't save them like points in Weight Watchers. So you use them or lose them. If they underdo it, that's fine. That's not going to be a problem. But my other big thing is no carbs alone. So a lot of people have an apple for a snack, or popcorn, or, you know, the best thing is honestly chips, cheese and crackers. It's a combo. It's protein with your carbs at least, you know. So I try to get people into the mindset that you always have to have some kind of protein or fat with your carbs. One of the biggest breakfast offenders is cereal with your milk, with a banana, all carbs, no protein. You're just starting your whole day off with a huge blood sugar spike and insulin response. So then we get on to the good news. Then they start to like me again. Free foods, no serving sizes, proteins, fats, and non-starchy vegetables. As much as they want, they are going to get full. I guarantee you, they will get full before they eat too much. A lot of people have concerns about fats being high calorie, but those calories take forever to digest. So they will keep them full, and it's a natural appetite regulator. So the calories kind of balance themselves out. We do talk about food quality, whether it's their carbs or their proteins. You know, processed meats are not going to be as healthy as your more whole, like chicken, red meat, fish, and also the different types of fats. And it blows their mind when I tell them that saturated fats are not connected to heart disease, and it's a very, very hard thing for a lot of people to accept. But I also shy away from corn and vegetable and soybean oils because they're more processed and higher in omega-6s. So we do talk about quality there. Then we have a different conversation about fat and heart disease. And emphasizing fats is really going to help with the blood sugar control. It's going to work on satiety and taste. And those two things are key for someone continuing to eat this way. I don't want to give them something that they're going to follow for 6 months. I want to give them something that is the way of eating for the rest of their lives. So that's, again, why I take a different approach with carbs, whether it's low or moderate. I want them to pick whatever will work for them in the long term. So, my results. I went back over the past year and a half and looked at all the patients I've seen. And I came up with 59 patients. So I excluded anybody who had gestational diabetes and anybody who didn't come back for a follow-up, or maybe they went off to another clinician, I never saw them again. So 44 out of those 59 patients have lost weight. So anything from a half a pound to 63.5 pounds, actually. All of those people who lost weight, I tracked how they were eating, and they were all reducing their carbohydrates, whether it was moderate or very low. 15 of my patients did gain weight, and they gained between like a half a pound and 10.5 pounds. That was the highest weight that they gained. And if they did gain, it was because they weren't reducing their carbohydrates. So my rock stars, my top of the pack. I just saw a lady yesterday. I was so excited. I didn't look at her weight on my computer. I was busy, and so I just took her to the scale, and I weighed her in. She's like, "Oh man, I was 230 on my scale at home." I'm like, "All right, well, sometimes people get a little upset over a couple of pounds, and it's later in the day, you have clothes on." So we went back, and if she was 233 on my scale, when I saw her in July, she was 253. She lost 20 pounds since July on her own. She was just doing awesome. So she follows low carb, high fat, but she also does intermittent fasting. She eats when she's hungry. And typically, that's maybe 2 times a day, maybe once a day. And I double checked with her, like, you're not hungry. She's like, no, I'm not hungry. Like, if I'm hungry, I'll eat, but I'm just not. So that's what's working for her. And I really don't have a concern about her with malnutrition or anything. The rest of her labs are looking fine. So it's really working for her, the combination. My next guy, he lost 47 pounds in about 5 months so far. I haven't seen him since August, but I think I have an appointment with them coming up in November, so we'll check in. He, again, I actually tried to give him the moderate approach. I thought that would work with him because he was having, oh my God, like 2 cups of fruit on top of like a whole big bowl of cereal in the morning. He was just like really carbo loading. And at first he was worried. He's like, I'm a big guy. Is that enough carbs for me? And I'm like, don't worry about it. If you're hungry, have more protein, have more fat. Don't worry about it. I saw him 2 weeks later just to check in with him because he was really kind of nervous. And he had already lost, I think he lost like 21 pounds in 2 weeks because he just decided to go whole hog into the low carb, high fat. And it worked for him. He is my one exception that I also monitor lipids because I have that cholesterol background. And he is that one exception that is sensitive to saturated fat. Out of all of my patients, he's the only one who his cholesterol went crazy out of whack. So we cut back on the butter, we cut back on the coconut oil, and it had more olive oil and more nuts, and his cholesterol corrected itself. So, and then rock star number 3, she has been seeing me monthly. She needs to come in for the support monthly, and so 6 months now. And I haven't seen him since April, but I looked in his chart, I was spying to get data here, and he has lost a total of 50 pounds since in the whole time since we first started seeing each other. And that's with a moderate carb diet. That's with 30 to 45 grams of carbs per meal and 15 to 30 grams of carbs per snack. This other person just started, I only saw him for a brief amount of time, about 3 months, but they dropped their A1C quite considerably. 5 points is a big thing compared to, metformin, which will drop at about like 1%, So he also lost a little bit of weight. He was like 170 pounds to begin with, so he didn't really have to lose weight. He just needed to control his blood sugars. Unfortunately, when I went spying to get data, his A1C has gone up to 8.5 because of the lack of follow-up, unfortunately. So that just kind of shows the importance of reinforcing the message and the accountability and the support. One more thing, medication reductions. So this one guy, he started with 30 units of Levemir when he was first diagnosed. And just by doing moderate carbohydrate, not low, he lost 26.5 pounds, and he completely got off his Levemir. He is still on, I think, metformin, an oral medication, but doesn't have to actually take insulin, which is wonderful. And we only saw him for 6 months, and he made some really great changes. This other patient, I don't know if people know units of insulin, but taking 35 units of insulin in the morning and then 140 units of insulin at night is just ridiculous, absolutely ridiculous. So when I saw him, he was having a lot of lows because at the times that he wasn't having a lot of carbs, the Levemir, the long-acting insulin was working too hard. So we cut him back on his carbohydrates to a moderate carbohydrate level, but eating consistently and adding more of that protein and fat helped to stabilize his blood sugars so they weren't going like this. And we've been working on cutting back his insulin with his endocrinologist, and now we're down to 15 units in the morning and 76 units at night, and his blood sugars are under better control now than they were with all of those extra the units of insulin. Part of the problem was also that he would go low, he would treat with juice, his blood sugar would go back up, you know, so it's been a very nice success story. He's no longer chasing highs and causing lows. He hasn't had any change in weight, but that's okay. And we're improving his health. And every time since the second time he came in, he comes in and gives me a huge hug. He's like, I feel so much better. Oh my God. So much energy. I feel so much better. So that's why I do this. So trouble areas. And Dave had kind of pointed out some of these things. When I'm working with my patients and they're not seeing the results that they want to see, usually they're not cutting back the carbs enough. They may think they are, but sometimes I'll start them off at moderate carbohydrate, but they're really insulin resistant. So we have to go a little bit lower in order to see results. Sometimes they're not carb counting appropriately. I had one lady, she came in for obesity, not diabetes, but she was like, all right, well, I was very proud of myself. I went to Olive Garden, which we usually go to. I only had half of the calamari. I only had half of the ravioli and a bowl of soup and a breadstick. And so I was like, all right, let's go on the website, look these things up. Let's see what the total amount of carbs was. 118 grams of carbs for that one meal. And that was her being conservative. So we have, you know, she just needed more practice with carb counting. There are those people who are just not willing to give up their sweets or their bread. And here in the Portuguese capital, my mother-in-law especially cannot give up the bread. Have to have bread with every meal. How do you have a meal without bread? So there are those people who, you know, that's their trouble area or their sweet tooth. And then there's the food addiction and triggers. And so I have one patient down in Portsmouth, Rhode Island, and really nice guy, really trying, but he really does have a food addiction. And unfortunately, he has a roommate who will welcome him home with a pot of pasta. That's like welcoming home an alcoholic with a bottle of gin. You know, it's really hard for him to resist. And as much as he's trying to make changes, he is one of my guys that gained the 10 pounds because he just hasn't figured out the strategy to deal with his food addiction just yet. And we're working on that. Two other areas that people have problems with. If they are totally on the bandwagon, totally reducing their carbohydrates, and they're still not seeing the weight loss or the blood sugar control, a lot of times they will have hunger and cravings, and I'm like, that should not happen at all. If that's happening, they're not having enough fat. They need more fat. I make them repeat after me, fat is your friend. It is a very, very hard concept in this low-fat world that we have all grown up in. So if there's hunger, if there's cravings, fat is missing. So a lot of times it's troubleshooting, okay, how do we get fat into the diet? And also a lot of people will get, like, feel like they're being bored or they're lacking options. Okay, I had my steak and my Brussels sprouts and my butter and what else, you know? So having alternative products, like I had a patient yesterday, he's like, I really miss bread, I miss sandwiches. And I'm like, well, get some Joseph's wraps or other low-carb tortillas or pita bread or whatever, and that will work as kind of a halfway between kind of an alternative. And so he's super excited to try that. And then recipes. So the two websites that I recommend a lot, just because they're really easy to remember, is alldayidreamaboutfood.com and ibreatheimhungry.com. And they have beautiful pictures. They have all kinds of different recipes. So if somebody is craving ice cream, go to All Day I Dream About Food. They have a whole category of frozen desserts that you can make on your own that don't have carbs. So that's giving people resources is a lot of my job at this point, which is wonderful. It's a great problem to have. I'm no longer struggling to get people to have results. I'm just trying to get them to find a way to make this livable for the long term. And also Googling low carb or paleo, keto for ketogenic, or fat bombs. are good ways to get things that have more fat in them. So in your packet, you have a couple of recipes to take home. So there's cream cheese pancakes made out of eggs and cream cheese. Awesome, so good. If you're wondering what a fat bomb is, there's a chocolate peanut butter fat bomb, and it's usually a combination of butter and coconut oil. They may throw in some cream cheese and regular heavy cream. There's a wide variety of fat bombs out there, but that helps some people who aren't able to add fat to their meals, and they're looking for something else, or they're looking for a sweet that is full of fat. Low carb chocolate mousse, this got me over my addiction of carbs. I made this almost every single night, but it's a good sweet alternative that is rather guilt-free. If someone is anti-sugar substitute, then that's where paleo comes in. And it may use some honey, or some other natural sweetener, but at least it's usually on the lower end of things, and paleo doesn't use grains, so you're reducing carbohydrates there. And then there's a couple of meals, grilled vegetable salad with olive oil and feta, so you can do vegetarian. You can do vegan, low carb also. And then, I love this one, kale and chicken stuffed mushrooms, delicious, absolutely delicious. So, takeaway, basically, shifting the focus away, shifting it from limiting fat to controlling carbohydrates has been awesome for me as a clinician, because I get to see happy patients coming back to me, and it's great for my patients because they get to see the tangible results, and it's so much less confusing if you connect all those dots that it all goes back to insulin resistance. They don't have to be on a cardiac diet and a diabetic diet and a low salt diet and a renal diet. All of that is so confusing for our patients. So, and when we talk more about fats, we can actually talk about being satisfied and getting rid of hunger and flavor and taste, which is awesome. So, I hope that was helpful.